Middlesex District Attorney Marian Ryan is reaching out to recovering opioid users. On October 23rd, she moderated a panel discussion at Lawrence Memorial Hospital in Medford to highlight ways to combat the growing opioid crisis.
The numbers are trending in the wrong direction. So while we are continuing all of our programs on the ground, we're really trying to develop some new policies, take this to a different level. And that's what we're trying to do here today.
Panelists included recovery specialists, those from the medical field, a district court representative, and former addicts, all offering their expertise on how to help addicts and identify solutions.
I think that to deal with the problem of substance abuse disorder in our society, the first thing that needs to happen is that we need to raise awareness. And in raising awareness, we need to reduce the stigma of addiction.
Ask for help. Don't give up. I always say to my patients, you need two things, willingness and courage. Those two things and resources, it can be done.
In the audience were people such as Richard Winnett, who is the president of Massachusetts Association of Sober Housing and is trying to create legislative change for long-term recovery programs.
We've been working with the State Department of Health on an initiative called the Sober House Certification Initiative, and that looks like it's getting rolled out in the coming months, where there will be a inspection and certification process. It is voluntary in nature, but if houses don't participate, they won't be allowed to accept anyone with any court conditions.
The district attorney stressed that legislation is only one of the parts that are necessary to form a solution.
We have really focused our multi-pronged approach on a variety of fronts. It includes education, intervention, prevention, treatment, legislation, and law enforcement.
The panel focused on educating the audience on how opioid addiction can affect anyone and everyone.
I want to say that substance abuse disorder does not discriminate. It could be, your siblings, your children. I grew up in a middle-class household. I'm college educated. I was a graduate student at the Massachusetts Institute of Technology when I was sent to prison for crimes that were a result of my drug use. So no one is immune from this disease, and there is treatment out there.
I think a lot of people imagine an opiate addict in an alleyway, homeless, dirty, with a needle in their arm, and that's not quite exactly what they look like. They look exactly like me. And people do recover, they get better, and they have a long, happy life, and I'm productive today, and I work as a nurse, and I love my life. Things can change.
For Arlington Public News, I'm Gabriella Kula.